Good morning and welcome to the Mental Health 101, Normalizing the Conversation. I'm Katie Whitcamp with the Business Development Team for the New Jersey Business and Industry Association. With us today is Frank Ganassi, PhD, Senior Vice President of Behavioral Health and Addiction Services Line at RWJ Barnabas Health and President and CEO at Rutgers University Behavioral Healthcare, and Suzanne Kunis, Vice President of Behavioral Health Solutions at Horizon Blue Cross Blue Shield of New Jersey. Both of our speakers will answer viewers' questions after their presentations. Before we begin, just a few housekeeping matters. Today's webinar is being recorded and will be emailed to you tomorrow, along with the PowerPoint for today's presentation, so be on the lookout for those. If you just can't wait, you can download them right now from the Handouts tab. But I'd also like to draw your attention to the Questions tab. The speakers would be happy to take your questions at the end, so get them in as they come to you via the Questions chat box. If you have any trouble viewing or hearing during this presentation, don't forget you will automatically be receiving a recording within 48 hours. So if you have to sign out and watch the recording, you won't miss a thing. So now, without further ado, Suzanne, please take us away.
Thanks, Katie. I appreciate it. 2 years into the pandemic, you'd think I would have figured out how to take the mute button off the presentation. I just want to thank you and the New Jersey Business and Industry Association for the opportunity to be here today and to be on this panel. So thank you so much. Let's go to the first slide. So we, as you all will not be surprised, are in a national behavioral health crisis. It's been going on for years, but it's just been so significantly impacted by the pandemic. Every one of us has been impacted in ways we never really even thought possible. And our children, it's just devastating. That's the only word that comes to mind when I think about this. For Horizon to support our members, like every health plan, we know we have to continually work to address the issues that are noted here on this slide. Stigma, the #1 reason why people don't go to treatment or ask for treatment or help. Access, quality, and rising costs. And these are the things that are at the core of everything we do here in terms of helping to serve our members. Next slide. So I just wanted to put out here some of the challenges that we face in New Jersey, which again, I'm assuming most of this is not a surprise to anyone. But again, stigma, it's really discrimination that impacts the ability for someone to ask for help and to access care. A fragmented delivery system. We talk about the fact that there is such limited coordination between primary care practices and behavioral health practices, and especially when you're trying to treat a person holistically. But there's so much fragmentation even within the behavioral health system. So this is a huge challenge to really help individuals get the care they need by making sure that everyone who is in the chain, if you will, of treatment is really able to coordinate and collaborate and make sure we take care of the person as a whole person, not just a condition. Access and capacity, there is a huge shortage of clinicians nationally, and personnel strain is just, and I know Frank can probably speak to this much more eloquently as he's in the trenches, but it's just the strain on the system and the resource capacity is just really limiting consumers' access to treatment. We look at child and adolescent psychiatrists. In this country, there are probably 8,300 or so child and adolescent psychiatrists, give or take, and we have more than 15 million kids that need services. So it's just really a huge challenge that we have to continually think of new ways to try to address. The opioid epidemic, we read about it every day. We know that in New Jersey, probably, I believe it's around 8 people are dying a day from an opioid use disorder. And add to that so many other deaths that are by suicide, et cetera, that are related to opioids as well as other substance uses. So, and then lastly, I'm just going to mention trauma. We have, talk about trauma. We're talking about COVID and how much more traumatic can something get for our kids, particularly around the issue of not being able to socialize and all the things that go along with that. So it's just really a very tough environment that we live in today, and we have been living in for the last couple of years, and it's going to take the whole village to try to change the dynamic and really help to get our state and our country on its feet the way it needs to be. Go to the next slide. So let's talk about mental health care in Black, Indigenous, and other people of color. The less than 2% of the American Psychological Association members are Black or African American. Some may worry that mental health care practitioners are not culturally competent enough to treat their specific issues, so that's a worry. Asian Americans are the least likely racial group to take actions on their mental health and are most likely to reach out to family and friends. But quite honestly, many of them don't have that kind of a strong support system and can have difficulty expressing their challenges due to guilt, shame, or even not being able to speak the same language. Poor communication with healthcare providers is often an issue. There's a shortage of bilingual or Spanish-speaking mental health professionals. Bilingual patients are evaluated differently when evaluated in English versus being evaluated in Spanish. People are more frequently untreated or undertreated than their white compadres. Next slide. So I just want to make sure and get people to start thinking, if you haven't already, about the fact that your brain is part of your body. It's an organ just like the rest of the organs, and there is such a connection between the mind and the body in everything we do every day of our lives. People are generally more comfortable talking about physical health issues than mental health needs, but there is such a clear impact of mental health on physical health. Let's look closer at the link between physical health and behavioral health. Nobody's immune. I'm pretty sure that every person in this call has a friend, a family member, a work colleague, or their own personal story to tell. Bottom line of the connection is, go through a couple of these bullet points here. People with chronic physical conditions have twice the likelihood of also experiencing a mood or anxiety disorder when compared to those without a chronic physical health condition. About a third of Division I football players who were injured reported high levels of depressive symptoms and need for depression treatment. It hits everyone. People living with severe mental illness are 53% more likely to have a cardiovascular disease than those who don't have a mental illness. And for individuals who have a serious mental illness, their life expectancy is significantly less than the rest of the general population for so many reasons, including not addressing not only their behavioral health needs, but the physical health needs are being neglected. And then lastly, I want to mention people with schizophrenia and bipolar disorder have double the risk for diabetes compared to the general population, while people with depression have 1.5 times the risk. So it's all out there. You are one person. Your mental health is part of your health, overall health. So mental health is health. And we want to make sure that message gets out there and we continue to break down the barriers of stigma. So speaking of stigma, let's go to the next slide. As I mentioned a moment ago, stigma is the #1 reason why people don't seek treatment if they need it. They're scared. They don't want to be judged. They don't live up to the Facebook or Instagram view of the world. There are cultural barriers and actually perhaps a sense of shame and secrecy, and that has to change. My hope is that I look at kids coming up today, they are so much more comfortable talking to each other about how they're feeling. They're not going to necessarily use the words depression, anxiety, but they're talking about how they're feeling and they're willing to put themselves out there, and they're not judged by their peers because everybody is being affected by this these days, particularly with the pandemic. So a couple of things. Really want to encourage people to talk openly about mental health. Encourage you to use your own personal stories. Again, for me personally, I have lost a nephew to a drug overdose in the last year. I was raised in a family with a father who had an issue with alcohol. We all have a story, and we need to be able to feel comfortable about talking about it and putting it out there so others understand that it's okay to talk about it. We need to educate ourselves and others. There are lots of jokes and comments that people make about mental illness. And when you hear that, let's use it as a teachable moment because it's not okay. And we need to, all of us, continue to fight this battle every single day so that we can look at people, again, as people, not conditions. Be conscious of language. This is something that has become so important over the last couple of years. Avoid using words like crazy or shrink. Again, these are all stigmatizing words. When we talk about individuals with a substance use disorder, we got to stop calling people addicts. People are not their diseases, they're people. And so let's think about that as we start talking about these issues and catch ourselves day to day using words like, oh my gosh, I'm going crazy, or things like that. It's just really, we want to try to think hard about how we speak so that people feel more comfortable and destigmatize the issue. Make sure we consistently and continually encourage equity between physical health and mental illness. Again, mind, body, all one. And then be honest about treatment. You know, people don't necessarily want to share any issues or information about what's happening with them. But if you can say, I have an appointment to go see my primary care physician for my annual checkup, or my gynecologist for my annual visit, you want to get to the point, or we want to get to the point where people can say, yes, I'm going to see my therapist, and not be ashamed or feel guilt or feel like they have to hide it. So it's going to take all of us, as I continually say, to just keep beating this drum and get us to a very different place as a country. Next slide. So the message we want to get out there is it's okay to not be okay. Even in the most progressive workplaces, many employees keep their conditions secret. They may be afraid that if they open it up, it'll hurt their reputation, it's going to compromise their work relationships, or even jeopardize their job. And in many cases, people are afraid it'll stop them from promotional opportunities. So all of these concerns can prevent employees from seeking help and getting better. So again, culturally, we have to start trying to change the dynamic. Next slide. So how do we do that? Yes, there are many challenges in the workplace during the pandemic, but there's also been new opportunities that have been presented as well. The door has been open to more dialogue around behavioral health and highlighting the value for employees and businesses with a more flexible, supportive workplace. And so what can you do to make that happen? Reward hard work, not overwork. I don't know about you guys, but working from home, I have no beginning or end to my workday. And so we have to consciously sort out the life that you have versus your work, because it's something that, as part of the pandemic, many of us just never leave our desks, or we're going back day and night. And we really need to have that focus with our team members and things like that to, again, reward them for hard work, not overwork. Be flexible wherever you can, work schedules, etc. People, when you go the distance for them in terms of helping them to live their life and their family issues that they have to contend with, they will go the distance for you if you provide that flexibility and understanding to the best you can, as long as it's, you know, you have to make sure you're running your business, obviously, but you want to do it in such a way that people feel comfortable, supported, and again, they'll work 150% for you if you do that. Train your leadership team to be empathetic. It's more important now than ever before, and this is not just an easy thing to do. So there are training materials out there and things like that, but it really needs to be an important topic that we communicate with our team members routinely as we're either in the office, returning to the office, and just to, again, lastly, to educate the workforce about what's available to them out there, and to know that there is help for them if they need it, and you have a willing listener, and in terms of your supervisor, your boss, and your company. Next slide. So everyone reacts differently to stressful situations based on prior experience and individual coping skills. Children and teens usually have less experience and don't necessarily understand the long-term impact of stress on their lives and their bodies. Those that are directly affected by this disease have a very different experience than those who are not. And people with underlying mental health conditions and substance use disorders pose particular challenges that really need to be addressed. So stress can, you all read the same things I read, right? Stress can lead to so many things. You can have somatic manifestations with stress. So that means I can't sleep at night, or I can't stop sleeping. Overeating and behaviors that tend to lead gaining weight. Difficulty concentrating, preoccupied with the news. I literally, for myself, I literally had to say, you will watch the news, you know, in the morning and then at night, and during the day it's off because it's so stressful. And you know, I know for children, I just had this conversation with a friend of mine. They are talking in school about what's going on in the Ukraine. They've just coming through the pandemic. They've stopped wearing masks. they don't know what to do, they're uncomfortable. And now there's talk of somebody who's sitting there potentially gonna put a nuclear bomb, launch a nuclear bomb. These kids have more stress than I think any of us could ever have imagined in our lifetime. We have to make sure that we're watching them and taking them to get the services they need, and talk openly. Talking is probably the best thing you can do, and let them know it's a safe space to talk to as a parent, as a sibling, etc. The other thing that happens with stress, it worsens your physical health condition. So if you are a diabetic or you have a cardiac issue, the stress that's in your life is actually impacting those physical health conditions. And as many of us have seen over the course of the pandemic, the stress associated with it has caused an increase in the use of drugs and alcohol. And it's not been pretty. And we have got to try to get ourselves, New Jersey has done so much amazing work in terms of trying to get ahead of the opioid epidemic. We are, in some ways we've taken some steps back with the pandemic, but we have got to get back on track and continuing to fight the battle that we have been over the course of the last several years. Next slide. So practicing mental hygiene is an ongoing process. You need to understand what it is and how to practice it, which can ultimately impact the quality of your life. So something as simple as routine being your friend. Set boundaries between work and home, which we just talked about. Having your meals, try as best you can to have them at a consistent time. Make sure you introduce recreational activities into life, and really just become more of a routine than we may have experienced over the course of the pandemic, for example. Manage your expectations. Don't underestimate the emotional issues associated with this pandemic. And again, many of you I know have seen and felt that yourself. Manage your stress by controlling the things you can. So prioritize your sleep, eat well, exercise, and again, think about drug and alcohol consumption during this time. I also encourage people, the kids, we talked about kids in the news, we should also be looking at kids and their access to social media. And lots going on there, as you can imagine. It's really try to protect as much as you can your child with controlling screen time as much as you possibly can. Easier said than done, trust me, I've been there. And then maintain connections as best you can. Like, make sure you're seeing your friends, make sure you go out and have a coffee with colleagues. Try to make sure we are bringing all of those basic, what used to be just normal course of every day, that have become so difficult under the conditions that we've lived in over the last couple of years. But really, just do everything you can to try to stay connected to people. And then lastly, manage uncertainty by staying in the present. We can't do the what ifs. What if Putin decides to do something over here? We have to live in the moment and really try to enjoy our lives as best we can in the moment that we're in. You can go to the next slide. So I just wanted to mention there's so many resources that are out there for people to access to, and so I wanted to talk about just a couple of these. So if you feel you might be misusing alcohol or other drugs, including prescription drugs, as a means of coping, reach out for help. If you're being treated for a mental health condition, continue with your treatment and be aware of any new or worsening conditions. Talk to your doctor, take your medications, make sure that you are living your best life, right? Diet, exercise, go to therapy if you need it, reach out to people for help. All of this is sitting there and available, and I encourage people strongly to don't ignore it. Make sure you access the services that you need and be free to talk about it. And then lastly, I just wanted to again give you a few phone numbers and website that you will be able to get to from Horizon. So if you just move to the next slide. And then to let you also know, there are some national helplines. So National Suicide Prevention Line is listed on here. And then as of July 16th, the new 988 web texting capability will be in place. So again, make sure people understand that and know that. And then there are other resources nationally that people can get access to. But I, again, thank you so much for having me here today. And we're here to help. So please feel free to reach out, and thanks again.
Thank you so much, Suzanne. Frank, feel free to take it away.
Thank you very much. And again, thank you, Suzanne, for that very informative beginning. And thank you for offering me an opportunity to be part of the panel as well. Next slide, please. So there are so many issues that are attendant to what Suzanne spoke about, and we'd like to make sure that those of you on the view this morning are aware that a cascade of services are available. I'd like to talk a little bit about how those services interplay and about how we are attempting day by day to be part of the solution. Clearly, many individuals who experience stress on the job have alternatives that are available through many of their employee assistance programs. And these programs focus on a number of different components of what can be part of the distress in normal day-to-day stressors. We look to try to reduce workplace violence with these programs. We encourage the appropriate use of both medical and behavioral health benefits. And by appropriate, we mean approaching them when they are going to be of assistance and in a way that's going to be allowed for both reduced negative symptoms, but way more important, improved functioning. These employee assistance programs can help to reduce job accidents. They can reduce workers' compensation and disability claims by helping to intervene before mishaps occur. They can reduce HR disciplinary actions and exposure to litigation, which I think is critical to a lot of people who employ large groups of people, just the way Horizon does and RWJ Barnabas Health does, and as does Rutgers. And they can help reduce turnover and retraining costs, which in these days of worker shortages and people reconsidering their lives, it's really important to try to maintain individuals who are already part of it. And finally, they can help to create a resilient culture. There's been a lot of literature over the last 15 to 20 years about not only recognizing, but also enhancing resiliency, this sense of self-agency in the world, which in the uncertainties that surround us allow us to maintain, as Suzanne talked about, not only living in the moment, but also looking to those ways in which our own agency, our own actions can help improve things. Across the RWJ Barnabas Health System and the Rutgers system, we are working to support well over 100,000 lives. And we have, in addition to that coverage, contracts with about 114 external agencies supporting another 60 to 70,000 lives. Next slide, please. I'd also want to make sure that people on the call are aware that New Jersey, through the Rutgers University Behavioral Health Center, has access to one of the nation's largest and most comprehensive call centers. There are national lines. Suzanne had mentioned 988, and recently we were just designated as the backup call center for the northeastern region of the country for that line. We are expecting an increase of about 3,000 calls a month at the very minimum to what it is already about 500,000 calls a year that we get on various call lines. We also have a national Vets to Warrior call line, which is a 724-365 global number. And that is unique in that it allows active military personnel from across the globe serving in any theater, national or foreign, to call, and they will always speak live, never a phone tree, to a veteran and allow them to speak either anonymously or to seek further care by talking about who and where they are and help. There are a whole range of other statewide options, which include a suicide prevention line. There's a 4BLUE-NJ, which deals with corrections officers. We have programs for mothers and fathers who are living with children who have behavioral health or addiction disorders, called a Care to Caregivers line. We have a cop-to-cop line, which is one of the original lines that we started, where active police officers can call 724-365 and speak to another police officer who's been trained in support and reciprocal peer support. And you can see on this that there are a whole range of other lines. Since the pandemic, we've stood up a nurse-to-nurse line. Many of you know that nurses have been front and center in the pandemic, and this has been an opportunity for nurses to call and speak to other trained nurses who can help with not only active empathy and listening, but also with resource identification when and if. We have similar lines for fire and EMS. We reach out now through the couple of FEMA grants that we've gotten recently for what's called a Heal and Rise line, which has been in response to COVID. And you can see on here that there are a number of other very specific programs and supports. Rutgers was pivotal with a woman named Peggy Swarbrick, who's nationally known for her the 8 pillars of self-health. And Peggy helped put together what's called reciprocal peer support, where peer specialists are trained, and in giving help to others, in fact, it also helps themselves. Next slide, please. We have a range of outpatient services, as you can see, between the Rutgers UBHC system, University of Behavioral Healthcare, and the RWJ Barnabas Behavioral Health and Addiction Service Line. We have locations really throughout the state. And these programs are both general and specialized in care. We make sure, as Suzanne pointed out, that we pay enormous attention to the gaps between levels of care. One of the places where jeopardy often occurs is when an individual leaves one level of care and then has to connect to another. And this is true in physical health care as it is in behavioral and addiction. We make enormous efforts to use case managers and peer navigators to help bridge those gaps and to do barrier analysis. Because as you can see, we have multiple locations across the state. We have specialty programs and things like eating disorders. We have been doing a lot of work recently on what's called trauma-informed care, which is not only a way of working with individuals who have histories of trauma, but it's also a way of working with one another, in that the culture of a workplace, especially during times of high stress, and the last 2 years have taxed people in many of the ways that Suzanne pointed out to before. It's important that the culture within care delivery is also one that recognizes trauma, because not only the patients that we see, but very often many of our coworkers themselves have histories of trauma. We do interventional psychiatric programs such as electroconvulsive therapy, which can be enormously successful with individuals for whom multiple medication trials have failed to alleviate their depression. It's also useful with populations who may be unable to make use of medications, like women who are pregnant. And so when properly utilized, it's a highly efficacious treatment, and that's part of it. We're part of a federal demonstration grant that's now been going on for 5 years. And we now have 5 certified community behavioral health centers. These are programs that are peppered throughout the state: Newark, New Brunswick. We have one down now in Monmouth County, and one up in Union County, Bayonne, Elizabeth area. So these certified community behavioral health centers are a federal program that originally started in 8 states. New Jersey was among the first, and Rutgers UBHC and RWJ Barnabas among the first in the state to adopt, along with about 7 other programs in the state. They allow for about 12 levels of care bundled within a prospective payment model. It's been enormously successful in helping people move across and between as their behavioral health or addiction waxes and wanes in either severity or symptomatology. Many people don't realize that we also provide, as a system, all of the physical health care, primary and specialty, all of the behavioral health care, and all of the dental health care for all of the state prisoners in the state of New Jersey. Up until just recently, that was about 19,000 individuals at about 15 sites across the state. Since the pandemic and since early release programs tied to the legalization of marijuana, that population has been reduced significantly in the last 3 years, but still sits at about 12,000 individuals for whom we provide care. We've been working hard to address populations of color. We have programs in place now at multiple sites across RWJ Barnabas Health to deal with the traumatic impact of systemic racial injustice and racism. This has become a large focus of our CEO at RWJ Barnabas Health and has steadfastly begun to try to break down those barriers and also to build up programming where individuals who provide the care represent the diverse communities in which we serve. New Jersey, I'm told, is the third most diverse state in the nation, and we work very hard to ensure that the workforce who delivers the care looks and understands the populations within which they are interacting. We think that's an important part of the trust that's inherent in successful behavioral health treatment. And as you can see on this, I won't go through all of them, but we're looking to build up our specialty program in areas like LGBTQ+ areas, and we also provide a variety of specialized care services for youth and adolescents. Very shortly, we'll be standing up the state's first comprehensive, academically based and research-informed addictions treatment program. That'll be a program that'll start this summer, and we're very pleased to announce that in the summer of 2023, we'll be opening the first residential and outpatient treatment program for older adolescents and younger adults, the 16 to 24 transitional age group that Suzanne talked about, who are experiencing enormous amounts of stress, not only from the pandemic, but also some of the social media issues that arise during that era and that period. And it's going to focus on mood and anxiety disorders as we continue to roll out programming. I also want to stress something else. We're putting a huge emphasis on the mind-body connection that Suzanne referred to earlier. You know, we've been undoing the Cartesian split for the last 400 years, and I think connecting how we feel and think with how our health occurs is an important connection. In doing this, we have been working closely with the Nicholson Foundation early on, and also with the Cherokee Health Model, which is a model that SAMHSA recognized as an excellence model that came out of Knoxville, Tennessee, a series of primary care clinics where behavioral health is integrated into the workflow of primary care, pediatric care. We now have that in place across a dozen or more sites, and our plan is to roll that out across several hundred of our pediatric and primary care practices. These are not therapists who sit in an office down the hallway and do 50-minute sessions. These are behavioral health specialists who are trained to do 15 to 20-minute interventions in real time during the normal flow of a primary care or pediatric or obstetrics visit. It's real time, it's solution focused, it's motivationally enhancement techniques, and it's designed to not only help people who might have behavioral health disorders that are uncovered in primary care, but even perhaps more important or as important, it's designed to work with individuals who are dealing with chronic physical conditions, and that certain habit management problems are getting in the way of them being able to manage obesity or hypertension or diabetes. And these behavioral interventions, without ever identifying or needing to identify a behavioral health diagnosis, can help individuals with behaviors that help them better manage their physical health conditions. And we're really very excited about that. Next slide, please. So we're able to move across a whole range of levels of care. And as Suzanne has said before, access is a critical point. Once individuals identify that they are in need of care, it's very important to be able to meet them at the level of care that they're willing to be involved. Some people may need emergency screening, and that can happen in many of our screening centers across the state. You know, others may need the stabilization and safety of an inpatient unit, but we always strive to try to do the least restrictive level of care. And the reason for that is important. We want to try to provide the right care at the right time and in the right amount, but we also want to make sure that individuals are able to stay fully involved in the meaningful life activities, work and family and school, that really constitute what makes people feel that their quality of life is where it needs to be. So we're able to do this with individual outpatient kinds of activities, group therapies, intensive outpatient. When needed, we can send people out in mobile crisis teams to do evaluations or interventions in the field for both adults and services. And we also run a panoply of 24/7, 365 walk-in emergency centers. You know, it's funny, when America was introduced to urgent care clinics, many people sort of voted with their feet to be able to go to care when they wanted it, where they wanted it, in a community-based setting. And we really believe that same model applies in behavioral health treatment, or can, and we're working to try to make that available as well. Next slide, please. We believe, too, that part of our mission, and the difference between a non-academic based system and an academic based system, is that we really have three, what we consider to be three responsibilities of equal importance. The first is to provide evidence-based, timely, appropriately managed clinical services or interventions to deal with behavioral health and addiction disorders, providing the right treatment at the right time, at the right location. But there's a second critical mission. We have 9 schools of healthcare professions, which includes psychology, social work, pharmacy, dentistry, primary care and family medicine, pediatrics, nursing, allied health professions, which is a whole range of them. And we train thousands of individuals a year at Rutgers who then go on for practicum work throughout the RWJ Barnabas Health System and the Rutgers delivery system. We feel it's our obligation to create that pipeline of the next generation of healthcare providers, both across behavioral health and the other program. We also do an enormous amount of training, as I mentioned before, on resiliency and self-care through the Behavioral Research and Training Institute at Rutgers University Behavioral Healthcare. We train well over 5,000 individuals a month across the state in new and improved evidence-based treatments for depression, anxiety, bipolar disorder, and a whole range of other behavioral health and addiction disorders. So we train them in evidence-based treatment, sometimes on contract with the state, sometimes in open-based programs. Last year, we trained over 70,000 individuals and 12,000 existing professionals across the system. And we also are proud to have 2 APA-approved internships. And again, we try to recognize the diversity of the communities within which we work and to integrate those activities into healthcare. It's one of our goals over the next 5 years that more and more percentage of the behavioral health and addiction services that we deliver are delivered in buildings that don't say behavioral health, but can instead say primary care or pediatrics or obstetrics or maybe even cancer. And to Suzanne's point earlier about reducing stigma, we find that many individuals are more comfortable receiving behavioral health care when they don't have to walk into a building that says behavioral health. And then finally, we were catapulted into a world such as we are right now of virtual interaction. Suzanne mentioned before that sometimes it's hard to know when a day starts or stops. But one of the benefits, if there are any, of the pandemic, and I try to be a glass half full sort of person, is that it's introduced in a much more rapid way the use of telehealth. Now, there are populations for whom telehealth does not serve. It's not as effective with geriatric patients who might be experiencing cognitive decline. It's not as effective with autism spectrum disorders. And it may not be as effective for people who need group-related therapies. But for many individuals across many mood and anxiety and addiction disorders, telehealth has been a godsend. And for those who are able to have the technology, and again, you have to recognize that the social drivers of health, people have talked about recently social determinants of health. We need to take into account that there are many individuals who could benefit from it, but because of lack of access to internet or lack of access to the kind of devices that allow them, it's simply not available. So we've always maintained and will maintain, as always, in-person presence. Next slide, please. We work very closely in going upstream. You know, Suzanne mentioned that many of these problems begin with children early on. Since I've arrived in 2016, we've gone from working in about 30 schools to now we're embedded in 180 schools and 27 community-based school programs across the state. And just about every time I look at this number, there are several new contracts. We work with school district closely to embed behavioral health specialty, and we work in doing early prevention in both in elementary and middle school and high school to try and target some of these strategies and emotional needs of both students and their families. You know, I really do believe that, you know, an ounce of prevention, pound of cure, that most of our grandmothers told us when we were younger, has importance here. And so we're committed to growing these programs across the state. Next slide, please. And then we're expanding, as I've mentioned before, into new areas. So one of the things I noticed when I arrived was we had tremendous resources across Rutgers University Behavioral Healthcare and the RWJ Barnabas system, but we lacked, I think, some of the focused specialty programs that I think it's the responsibility of an academic center to deliver and to do research on. So as I mentioned before, we'll be opening up an addiction center of excellence, which will have everything from inpatient medical detoxification right up through ambulatory services, and including induction and medication-assisted treatment for opioid disorders. I mentioned to you before about this new center for older adolescents and young adults. That's going to sit in 2 brand new buildings on a setting 4 acres of wooded property on the Rutgers University Cook campus, which is, some of you might know, is the agricultural campus. We're in the, right now for both of these programs, we've already recruited 2 nationally known research specialists with really international reputations to help drive the program and to advance the science of that. We'll be doing the same thing with the older adolescent and young adult program, and we'll be hiring a nationally known researcher in mood and anxiety disorders for that population. We're expanding our eating disorder programming to include more inpatient beds and the more ambulatory IOP programming. We have grown substantially. When I arrived, we had about $2 million a year in federally funded research from NIMH, NIDA, and the National Institute for Health. And this year we will be reaching about $30 million a year in funded research. I plan to double that again in the next several years. I believe it's our obligation to not only provide care and to teach the next generation, but also to advance the science. We're committed to doing that. And we're also focusing work with our BIPOC individuals and LGBT+. And also we're developing now comprehensive BIPOC leadership development programs and mentorship programs so that we can move individuals of color into increased positions of responsibility and leadership throughout the organization. We feel it's our responsibility, and we're committed to making sure that individuals have opportunities for ladders and improvement in their own career development, which we feel is critical in delivering to diverse populations of health, and also critical in providing them ways to stay with us and grow. And then finally, as I mentioned before, we have a huge focus now on integrating behavioral health care to primary health care. Next slide, please. And I'll end with that, but let me just end with one note. I believe that while there are many, many things confronting us, both globally and pandemically and politically, I also think this is a rare moment for us to pull together in a growing number of resources across the educational, the research, and the service delivery world. And I do believe, and I remain very optimistic, that as we pull these services together, we can better service the communities and achieve what I think is all of our goal, which is a far healthier New Jersey. And so with that, I'll end, and thank you very much.
Thank you, Frank and Suzanne. Don't forget to please put in your questions in the chat box. We did have some that came through, so I'm going to put it out there, and Frank, Suzanne, you can decide who wants to answer. For those of us who work in small businesses or small offices where there are not many secrets, how do we talk with our employees about confidentiality and yet also encourage them to share how they are feeling?
So I can start, and I can start. It's hard, right? And small businesses, you become more like family, right? So think about it as if people will think about it as if they're talking to a family member. But we also have an obligation to talk to each other about the fact that as much as I really don't want you to talk about the fact that my nephew passed away last year from a drug overdose, you got your own issues that you don't want me to talk about. And so we owe it to each other as colleagues, as family, a work family, to consistently deliver the message that we're all in this together. We all have problems. And so if anybody's thinking that they're immune, they don't live in the world I live in, at least. And so I think it's really all about talking, respect, and expectations.
And how do you strike that balance of that?
I wish I knew that magical answer. But go ahead, Frank, did you want to say something?
Yeah, no, I concur. It's, smaller work settings are, can be wonderful places. And this idea of it being sort of like a family, I think, is it at its best. I also think that different individuals experience the world with different boundaries. There are people who are more extroverted and who gain energy, both in bad times and good, from interacting and sharing and being transparent. But we have to also be respectful of people who tend to be more introverted and who gain their energy by going off by themselves, and for whom sharing is not necessarily egocentric. It does not make them necessarily feel better. The real trick, I think, is for leadership to demonstrate that we're open to all kinds of ways in which people make themselves feel better. And I think for those who find that sharing and interpersonal interaction, to encourage that and to make that feel welcome, and also to respect those folks who have different boundaries as well. It's a tough balancing act.
True. How can you help, or how would employers create an environment that promotes mental health as a priority? Is there things they can do?
I can take that one real quick. So again, it all goes back to some of the things I mentioned before. Let people feel comfortable they can talk openly about mental health and make it a mainstream issue or a mainstream topic. You send out flyers to employees about get your flu shot, or we got diabetes prevention going on here. We could have mental health assessments, clinics, topics, stress. You don't have to use the words mental health necessarily. You're talking about the things that people can hold on to, right? Stress and anxiety and things that are mainstream. It's about changing your culture, and it takes time to make it happen. It doesn't happen overnight. We've been really intentional within my organization, Horizon Blue Cross Blue Shield, about encouraging our leaders like myself to share our own personal stories, because then it makes it feel okay for other people to say, I live in that kind of world. I can't tell you, I did a video about my relationship with my father. I had so many employees reach out to me, and it was amazing. And at first I was a little uncomfortable, like, okay, I'm gonna warn to my siblings, I'm putting this out there so you guys all know. But it was really a wonderful thing, and people felt comfortable coming forward to say, I lived in that same world that you lived in. So it helps the conversation, it reinforces the prevalence of mental health issues or substance use disorders, and let people know they're not alone. So it's one thing, stigma to anti-stigma, to get those barriers broken down at a time.
I agree with everything Suzanne said, and I want to just add, we have some very creative people at RWJ Barnabas Health and also at Rutgers University, far more creative than I am, who have been able to produce these little packets of helpful information that are available 7/24, 365 through websites that are pushed out to people or on portals. And they've had interesting, so there have been ones around called 90 Seconds of Resiliency. There's a whole series of them. And it's individuals from across the organization who are sharing with others what they do to help enhance their own resiliency. They're little bite-sized pieces, 90 seconds long, very well produced. There are others that are 30 seconds of stress reduction. And we try to get this into a package in a way that people can access it. So you're addressing mental health through the ideas of providing people with these variety of tools that help them do some of the things Suzanne talked about before. It can include deep breathing. It can include mindfulness activities. It can include use of brief exercise periods throughout the day. There are a variety of things people can do to enhance it, but at the same time, what you're recognizing is that behavioral health and mental health issues are okay to both talk about and address.
And I think that COVID probably brought that a forefront more and made it okay for people to say that they have issues. And I think, Suzanne, you had mentioned it with the advent of social media. So many people are out there saying things, making it prevalent, making it okay to talk about those things. We did get a question. How do you incorporate the necessary mental health support systems and social service agencies where high productivity is necessary to keep the agency afloat?
Now, I want to make sure I understand the question. Are they talking about high productivity for the people providing behavioral health services, or high productivity in workforces who might need mental health treatment? Which way are they talking?
I think just in agencies, let's say, how do you incorporate? I'll reread it. We can all kind of go, and maybe if the person who put it out there wants to ask, how do you incorporate these necessary mental health support systems in social service agencies where high productivity is necessary to keep the agency afloat? My take on that, and the person can put in, is how do you let people take the time for mental health when they are such high pressure jobs?
Got it. Suzanne, I have thoughts, but Suzanne, I'll let you go first.
Sure. So as I think I mentioned earlier, I think it's part of this is on the employer to say this is an environment that we encourage because it's important. First of all, if you're a high productivity focused area, you have stressors built in just by virtue of the fact that that's the kind of organization you work for. Employers clearly know that because I'm sure they're feeling the same way you are, although they're not on the line. And I think they need to set up an environment where they make the time for you. And sometimes it's, sometimes we do things right before hours, lunch times or whatever, to not make it as formal a process, but it's really working with the employer who gets the fact that this is an issue. People need help and people need a safe space and an opportunity to help themselves. And if they're smart, they're going to make it happen, because I've learned over my life here that the more as an employer will go out and be an advocate for their employees in terms of what they need, the harder they're going to work for you and the better product you're going to get in the end, and everybody wins. Frank?
No, I concur. I think a big responsibility for employers, and these are both within the healthcare field and in manufacturing, and regardless of what the business line is, building in opportunities for resiliency and support. In the old days, it used to be you built in time for CEUs to help people get continuing education credits or certification credits for their electrician degree. I think it's equally important to look for opportunities to build in time for self-care, for learning ways to manage and identify stress. And those are things that can be baked into the day, both in real-time activities where, during a staff meeting, time is put aside to do that, or in asynchronous ways in which you make available video clips and trainings that people can access at their own time and in their own schedule. I think both are going to be important in the days and years ahead.
And I agree. And I think listening to you speak, Frank, when you said, I think that employees have a better time calling in, if you are in the corrections or law enforcement or medical field, talking to someone who has been there rather than talking to somebody, we've all been there, where you might talk to a doctor who doesn't understand your disability or your health concern. So you kind of wonder, but these people are in the trenches with you. That led to another great question that we got. We have a trend of younger employees calling out due to not being in a good place mentally today. And while we know there is a huge increase in mental health disorders right now, how can it be addressed professionally while still maintaining expectations of presence and professionalism? To question the validity of such a concern could be an act of discrimination.
It's not easy, right? And that's why I talked earlier about the fact that the younger generation, folks coming up, think very differently about mental health, taking care of themselves, and they're going to do that. And you know what? We have to create an environment where that's okay. You don't want somebody abusing it. You're going to watch that over time. But lots of people are now saying, I'm taking a mental health day, and meaning I'm taking a mental health day. And we've just got to get to the point where that's okay. We got to watch for abuse, but we have to start thinking a little differently that we got to take care of ourselves, because if we want to be here for the long haul, if we don't take care of ourselves, we'll just be a flash in the pan. And that's not good for any of us.
No, I agree. You know, it's funny. I think people have always taken mental health days. They've just not called them. And I think 30, 40 years ago, people would say I had a headache or I felt like I had a cold coming on. But the truth of the matter is they were feeling overwhelmed. And so I think I give credit to this generation for identifying and calling it what it is. You know, I've noticed myself, I've been involved in this work for probably 35 years. And I remember when I first worked in an academic setting, which was my first job, residents, trainees, PGY 1s through 4, worked 75 to 80 hours a week. They never married. They never got kids, had kids while they were in the resident program. They never bought houses. You look at residents now, their hours are far more realistic and sustainable, and many of them are getting on with their lives while they're training. They're getting married, they're having children. I actually think that's a more sustainable model, and I think the workforce should reflect that as well.
And I think employers need to understand the fact that the workforce that's coming up is not like the, you know, it used to be, you know, work 35 years for the same company and you get a gold watch at the end. And today it's like if you keep somebody for 2 years, you're doing okay. And so so you have to also operate recognizing that that's the environment that you're in, and really encourage people to like bring all those these don't cost anything, but these are non-monetary opportunities for people to be able to feel better, feel like they're getting out of their workplace the support that they need.
Great. That's about all the time that we have right now for questions. You can always reach out to NJBIA if you have anything, and we can get it over to our wonderful speakers. Frank, Suzanne, do you have any last words or thoughts?
I just want to thank you for bringing this to this group's attention. I think these are critical issues. My hat's off to you for making this transparent and giving people an opportunity to think about it. And to the employers out there, you know, I wish you continued good luck in sustaining and maintaining an active workforce. And when things go off the rails, we're here to help.
And I just like to say, I echo Frank's comments as well. If there's one thing we can walk away from this meeting as a call to action, if we all focus on reducing stigma and really making this, again, a mainstream topic, and don't judge people, don't use the words that are cut you to the quick. Really just be conscious of stigma and how we can make this a very different working environment and the world we live in, because it's so important to we're again, mind, body, we're all one person. And all of this translates into affecting our overall health. So, and again, thank you so much for having this panel to start with, and really enjoyed the time and more than happy to answer any questions later. And just so you know, if you're a Horizon member, we've got lots of support and services for you. So feel free to reach out. Thanks.
Great. Thank you both again. Don't forget to all of you out there that you will be receiving a recording of today's webinar and the PowerPoint slides via email. Lastly, when you close out of the webinar, a survey will come up on your screen that we hope you will fill out so we can understand how to best provide you the most important information in webinar format. Our next event, the Table for Four Virtual Networking, will take place on March 28th from 12 to 1 p.m., so feel free to register at njbia.org/events. So until next time, for Frank, Suzanne, and myself, thank you for being with us today, and we wish you and hope you have a wonderful day.